spontaneously go into labor. Someone believes your obstetrician, or sorry, not your obstetrician, your provider, if they believe that your belly looks too big, or just by the way it looks, there's no medical reasoning as to why someone should be induced. Um, the size does not reflect how a baby's weight is. Um, of course, there should be further investigation if it is significant. Or if your provider's leaving town, that is just for their convenience. It is not for you, and that is not the way healthcare should work. Um, but you believe that an induction labor, or you were told that induction of labor is easier than your body going into natural labor. Induction of labor is much harder on the body. We are forcing a process that is not meant to be happening at that time. So it might take longer, and it's also harder to pretty much cope in the hospital where you're being continuously monitored, you know, strapped to all these wires. It's just not gonna be a good time. It is better if possible, to go into spontaneous labor. Of course, we can't control everything. Um, how can we implement a physiologic labor for all women? We can, number one, educate women about labor and symptoms and how they can do it. Women have been doing it forever. However, we have taken that confidence away from women, and we need to give it back, to help women kind of reduce their stress and help feel a little bit smoother about what their body is doing. We should also wait to admit patients until they're in active labor rather than early labor. If they're in active labor, um, typically they will receive less interventions, which will reduce in greater outcomes. um, However, that kind of depends on if there's your first baby or your third baby, depending on how dilated you are. Typically 6 centimeters is considered the new active labor. um, we should also educate women on coping skills, so that means um, acupressure, aromatherapy, music therapy, movement, heating cold therapy, um, anything that is not drugs that they can do at home that can help them labor for longer at home rather than them coming out of the hospital early labor. Um, it will if we do more intermittent auscultation, so that means we listen to the baby every now and then rather than continuously. This can allow women to move more. If we do appropriate staffing, we will have the ability to do all of this and to coach families during this process rather than having to go back and forth. It's just better to be right there as long as we can, as well as continue to move if a patient has an epidural or some sort of heavy anesthesia, as labor is an active event, and we should be moving women even though they're immobile themselves. So pretty much that is my presentation on how we can reduce C-section events, and those are my references. Thank you very much.